Now we're going to talk about mammographic calcifications and DVT. So according to BI-RADS, calcifications are identified on mammography are grouped into two large categories, typically benign and suspicious. Typically benign calcifications include skin, vascular, coarse, large rod-like, round, rim, dystrophic, milk of calcium, and suture calcifications. And these are not typically hard to identify or put into these categories. Suspicious calcification morphologies include amorphous, coarse heterogeneous, fine pleomorphic, and fine linear branching. And all those suspicious calcifications meet the criteria for recommendation of biopsy. We know that because previous research has shown that the positive predictive value of calcifications with these descriptors, amorphous, coarse heterogeneous, fine pleomorphic, or fine linear branching, all are above the 2% threshold, which we recommend biopsy for. So in this case, amorphous, 21%, 13%, 29%. And these top ones, amorphous, coarse heterogeneous, and fine pleomorphic, all fall in the BI-RADS 4 subcategory for B, because there's between 10 and 50% risk of malignancy. The only one that falls into BI-RADS category 4C is fine linear branching, because there's a 70% chance of malignancy with that morphologic descriptor. You may notice that there are no calcifications that fall under the 4A category. In addition, there are no calcifications that definitely fall under the BI-RADS 5 category either.
Calcifications may appear more or less suspicious as compared to full field digital mammography.
Part of that is related to computational reconstruction of those projection images, which may enhance or decrease the appearance of calcifications. The acquisition time of DVT, as I mentioned previously, increases susceptibility to motion artifact, which can make calcifications, especially subtle ones, more difficult or impossible to see. DVT, however, can help to better assess dermal calcifications or artifact, which we saw on previous cases. For example, in this case, we can see that these calcifications are projecting on the medial aspect, right? And we see here again that situation where there are multiple image slices that are added to the DVT stack, but gets on the detector side. So despite the fact that these calcifications are clearly in the skin, there's a few more slices here. But we can be confident that if we see them at that location, that they are dermal calcifications and therefore fall into the typically benign category. Similarly, in this case, we see some calcified material at the superior aspect of both breasts and the axillary regions, and this is compatible with deodorant artifact on the skin. And we can prove that by seeing that that material is demonstrated in the skin on DVT slices. So a lot of work has gone into trying to understand the impact of DVT on the evaluation and detection of calcifications. There's been no significant improvement in the detection of malignant calcifications with DVT. If we look at DVT plus SM, we have about an 85% sensitivity for malignant calcs, and DVT plus full field digital mammography has about an 88% sensitivity, a little bit better, probably related to that increased better resolution with the full field digital mammogram, but specificity is improved with DVT. However, we may get some better visualization, particularly if the reconstruction algorithm sort of increases the conspicuity of calcifications, and classification into benign or malignant may be improved or putting into one of those specific categories. In addition, we have some localization information which might be helpful, and determining distances between groups of calcifications may be more accurately assessed. At the current time, magnification views are still recommended for diagnostic evaluation of calcifications identified at screening mammography, and that's purely related to the improved resolution of magnified mammograms. So in this image here of a synthesized mammogram taken from a screening mammogram, these same calcifications, you can see a lot better resolution, a lot more calcifications on the magnified view, and therefore it's still recommended to do magnification views in the workup of all calcifications. And here, especially in this case, we can see that these calcifications on the SM view don't look particularly suspicious. Maybe a couple little round calcifications. Maybe you might get to fine pleomorphic here. But here we can distinctly see some fine pleomorphic calcifications. There's a lot more of them. In addition, you might also wonder about associated asymmetry.